You are welcome to my channel. Thanks for visiting. Please remember to subscribe if you haven't. But if you have subscribed and you are visiting again, I'm saying a big thank you. Today, I'm going to be talking about a medical condition known as rumination. I know some will be asking the question, is this a medical condition truly? Well, without further ado, the next few minutes, you understand. Let's go. For us to understand this topic very clearly, let me go through certain definitions. Ruminant animals. Example of ruminant animals will include the goat, the sheep, cattle, giraffe, deer, and the list goes on. Ruminant is a Latin word, ruminare. That is where ruminant has come from a Latin word, ruminare. And that means to chew over again. If you are familiar with the animals that I listed just a while ago, you understand that they do something in common. They go to the field, they graze. Later on, they'll come down and sit down. They will regurgitate, chew the cud, and swallow again. They have that capability because they have specialized stomach that has 4 compartments: omason, abomason, rumen, and reticulum. Though we as human beings, we don't have the stomach with 4 compartments, but sometimes we do something close to what these ruminant animals will do. And that is why the definition of rumination is similar to what we find here. So in rumination, it is all about chewing the cud as we found in animals, but in humans here, the individual will regurgitate after feeding, and then it depends on what will follow. The individual could swallow or vomit or spill the content out. First thing first, there must have been a meal, right? Then without effort, the content of the meal will regurgitate back to the mouth. And the individual could spill it out, could chew it again, could swallow it back, could vomit. In English language, I've just brought this out to corroborate this definition properly. To ruminate on something means that you are taking a deep thought about it. Then you can take your decision on what to do later on. So, rumination here in medicine means the content is back to the mouth, then you can decide voluntarily what you want to do about it. We will suspect rumination as a diagnosis if the history is such that without any effort, the individual is regurgitating the content of the meal taken about 10 or 20 minutes ago. The history will also involve that there's no ration. Then the individual could choose to chew, swallow, or spill or vomit the content. Now let's go through the clinical features that will help us as per the history. Like I've said, no ration, it is effortless, right? Regurgitation is occurring, but it's not preceded by nausea. It could be preceded by abdominal fullness or increased intra-abdominal pressure, with or without pain. The content is going to be the same. In fact, the taste of regurgitate will be the same as that of the food eaten prior. Digestion is incomplete because it's going to occur very close to the time you are done with the meal, 10 to 20 minutes after feeding. So regurgitation has occurred. Then you have the choice to make, or the affected person will tell us the choice he or she has made. It's either to chew again and swallow or vomit. Or some just say, I'm going to spill it out. Whatever the choice made. That is the part. Then there may be or not metabolic derangement based on the following. Number one, if on the time after regurgitation, the process is completed by vomiting, there may be electrolyte imbalance, and the individual can even lose weight. But regurgitation, chewed and swallowed back all the time, then I don't think we need to bother ourselves about metabolic derangement. So that is why I put with or without metabolic derangement. If you are concerned about the epidemiology of rumination, don't worry yourself, it can occur anywhere, any race, any age, and is known to be associated with certain psychiatric conditions, post-traumatic stress disorder, anxiety, depression, and even eating disorders. When it comes to possible differential diagnosis, we can put cyclical vomiting there, bulimia, gastroesophageal reflux disease, and here is the link to a full presentation on gastroesophageal reflux disease. It could be achalasia or anorexia nervosa. The brief title here is such that this is a retrograde flow of gastric content. Now, antegrade is going down, retrograde is coming back up to the mouth, right? Through a long, slow esophageal sphincter. And this could be enhanced by raised intra-abdominal pressure. So that is just the brief pathway that I can give here. Making diagnosis of rumination is easy through the history. History that, after meal, few minutes after, you feel something in your mouth, and when you check it, it's the content of the meal you've had prior. Okay? Then no retching without effort, effortlessly. Then the content came back to your mouth. The taste will be the same like the meal you've taken 10 or 20 minutes ago. So it's that simple. But we can go further and compare the regurgitate to the previous meal, to be sure. And when that is the pattern, then we can conclude this is rumination. You can go further in individual that will say, okay, when that happens, I vomit the content out. I go to the washroom or toilet, depending on where you are. Then you have to find out what is happening to the electrolyte right now. And of course, history of whether the weight has been lost, should be ascertained as well. If we want to go further, we can have endoscopy done through the esophagus, gastric, duodenal, and so on, to look for any obstruction along the gastrointestinal tract. Usually, like I've said earlier, correct history will suffice as per diagnosis, because rumination is a functional problem. But for medical legal reasons and to have peace of mind and to rule out other possible differential diagnoses, we can continue with endoscopy we've mentioned and also have manometry studies done. CT, MRI can be employed, and then we can send a referral to psychiatrists, just to be sure it's not something else. Lastly, the treatment. Once correct diagnosis is made, nothing much to do. We can have psychotherapy. Psychotherapy will be needed because we need to encourage the individual, because they will not be eating in the public. They can feel embarrassed, feel ashamed, then become depressed, or when there is gathering and they need to have group eating, dining with people, they become anxious. So psychotherapy will be pretty helpful. Then we may advise that eat slowly, eat small quantity. You can eat frequently so that you don't lose all the nutrients you need to grow and for normal life activities, just as we do in gastroesophageal reflux disease. But we don't need all the medications meant for gastroesophageal reflux disease right here, because they will not work. Yeah, they will not work here. We don't need proton pump inhibitors here. No, we don't need that. Then you can embark upon diaphragmatic breathing. Then if you are not winning with all this, you can pick antispasmodics like baclofen. Then that's the reason, right? Then any associated condition or conditions should be treated appropriately. With that, I've come to the end of this short presentation. Rumination is not in the animals, on the farm. Is possible in humans. So with this short presentation, you've gotten the clearer picture of what rumination is all about. Do you have anyone having this around you or yourself? Now, approach your physician about this. Thanks for listening. Remember to share this with all your friends. Please share this on your platform. I appreciate it.